Hi, everyone who is joining today. I am Monique Salas, North American Healthcare Business Development Manager at SageGlass. Emily Anthes is an award-winning science journalist and author. Her work has appeared in the New York Times, The New Yorker, The Atlantic, Bloomberg, and many other publications. Today, we're going to be chatting about her latest book, The Great Indoors, The Surprising Science of How Buildings Shape Our Behavior, Health, and Happiness. Thank you so much for joining me, Emily.
Of course, I'm happy to be here.
So congrats on your new book. Yeah,
Thank you.
We're so excited to have you. I read your book, and I'll be honest, as I'm walking through my own house now, it's sort of like a minefield. I think and look at dogs and cats in different ways, and you just don't think about how we track different things in our house and how that kind of impacts our environment. And so when I was reading your book, it just made me so much more aware. So, offhand, thank you for that. I think it's really important just to provide the education and information so we can kind of sit in it and think about how it impacts our everyday lives. So I just wanted to give a quick shout that it definitely has helped me. And congrats on your new book, which just came out in June. Obviously, you wrote the book well before the pandemic hit and our lives have all completely changed. Do you think COVID-19 is going to change the way that people read your book or affect maybe the demand of the book?
Yeah, absolutely. I mean, fortunately, I did not write anything that, is radically changed or contradicted by the pandemic. But I think it definitely gives the book a new resonance in a couple of ways. I do talk in the book pretty explicitly about how we can design spaces that reduce the spread of infectious disease. And so while I didn't have COVID in mind, some of those lessons apply. But then the other piece of it is, even beyond the disease itself, like we're all spending so much more time in our homes. And so I think there are a lot of lessons from the book about how we can create homes and indoor spaces that are really restorative and help keep us healthy and happy. And sort of, there's plenty of stress during this period, but through some changes to and attention to our built environment, we can try to minimize that and create spaces where we feel safe and comfortable.
I love that. And I would have to agree. While I think the book is written in the spirit of, a company or a workplace environment, I think what was, to your point, really resonated with me was I'm spending so much time indoors. I'm giving this interview from outdoors, and it's nice to be able to kind of fluctuate from inside to outside, right? Because there's a different feeling that's associated with being outside. But it's been really great to have the frame of reference and to just think about spaces in different ways, like maybe adding a purifier or something that's going to help with the airflow. And that is really coming from reading your book and really thinking about how I can start to inject that. So again, thank you. Curious, what sparked your interest in the topic of buildings? Like, what drove that for you?
Yeah, well, so I'm a science writer, and so my day-to-day work, I spend a lot of time reading scientific journals and sort of trying to keep track of and pay attention to studies, new studies that are being published. And 7 or 8 years ago, I started noticing some studies on what was sort of being called the Indoor Microbiome. And what scientists were doing was they were going into buildings, homes and schools and other environments like subways, and they were swabbing surfaces and collecting house dust and then sequencing all the DNA that those samples contained. And by doing this, they were getting sort of a snapshot of all the microorganisms that are living in our built environments. And the findings themselves kind of astonished me. I think one paper found that an average home has something like 2,000 different types of microorganisms. And that was just mind-blowing on its own. Yeah. But it also sparked this sort of aha moment for me about like, oh, we spend all this time in our buildings, 90% of our lives indoors, but I never really thought much about like what was happening in them. And it made me realize that these environments are so much richer and more complex than I had realized. And so that was sort of the spark that prompted me to say like, oh, well, like what else is there to be found about these environments? And, what power do they have that we often overlook? But it started with, those few studies on microbes.
What I found fascinating in the book was the notion that when we move, we bring, essentially, we're like a traveling microbiome.
Yes.
It's kind of scary, but it makes so much sense.
Yeah, and you know, I should say, you know, I know some of that stuff is creepy, and people might be sort of squicked out, to use a scientific term, about thinking about all these microbes in their homes. But the vast majority of them are benign. There are some pathogens, but then also there are some that are beneficial. You know, a lot of these microbes are absolutely crucial partners in keeping our bodies functioning normally. So I hope people won't be too, you know, grossed out to learn about all these microbes, because really they're, you know, they have a symbiotic relationship with us.
Absolutely. Absolutely. And I mean, I think I'm glad that you called that out, because initially when I did read it, I did get a little bit creeped out, but, you know, I thought to myself, and this is totally non-scientific, right? But I thought, well, germs are good for us because essentially it's expanding our immune system's ability to respond and hopefully giving us that kind of wherewithal that we need. So when we hit the world, that we are stronger. So I definitely kept that in mind and was less grossed out, but thank you for covering that.
Sure.
So there's so many different conversations that we could have about, you know, the book, but I'm really interested to hear what you learned about daylight and views. In my role, you know, I focus on daylight all the time. You know, being a part of electrochromic glass company, one of our principal value points is that we're providing people with access to natural light without the glare, which is something that, you know, they just don't have access to when we're talking about standard glazings. So what are 2 or 3 nuggets of wisdom that you gained while researching the book with regard to daylight and views?
Yeah, well, so, you know, as it happens, daylight and views are probably, and particularly views of nature, are 2 of the most important things you can provide building occupants. There are just reams and reams of scientific literature. You know, I talk about some ideas and interventions that there's a study or 2 here or there, but when it comes to daylight and views, it's just, you know, an overwhelming amount of evidence that they are good for us in almost every way. So I guess to take those one at a time, like daylight is really important in boosting our mood. There have been studies on, you know, patients in psychiatric hospitals with depression, and they actually recover faster if they're assigned to rooms that are sunnier than rooms that are darker. The other really important thing daylight does is keep our circadian rhythms in check. And so exposure to sort of the blue spectrum light that that occurs in the morning is really important for keeping you both alert during the day and also helping you sleep better that night. So that's daylight. Views of nature are also really important. There's a lot of evidence that it can reduce stress, reduce anxiety, reduce pain, boost concentration and focus and productivity. You know, a couple of the studies that have really stuck with me, there's a famous study from 1984 that showed that surgical patients who have rooms that look out onto trees actually use fewer painkillers and are discharged from the hospital sooner than those who just have a view of a brick wall. And then if you get into the cognitive stuff, there are really interesting studies about like students who go to school in classrooms that like look out onto natural landscapes have higher test scores than those who look out onto sort of more man-made landscapes. So basically, if there's anything, any positive outcome you want to encourage, almost anything, daylight and views can help do that. They're really critical for building occupants.
Fantastic. Thank you for that. And I like how you parsed out views of nature versus just daylight in general. So in my role, I focus on patients in healthcare, right? And our impact that we can have on the patients and staff and nurses who are oftentimes working double shifts and really don't have the ability to kind of go outside. So it's really important for them to have access to daylight or views of nature. And what I find most surprising is that studies have actually been, the 1984 study you mentioned, I am familiar with that study, and it seems so obvious, right? Like of course, if you got a brick wall versus daylight, you're probably gonna have better outcomes. So what do you think building owners and architects, what are their biggest mistakes when they're thinking about daylight and views, given the data is so supportive of access to daylight access to natural views. Like, what do you think is missing there?
I mean, I think despite the evidence, there's still a way in which we view or building, managers or architects view daylight and views as luxuries, as like something that, if you think about like the corner office or, like maybe the higher ups in an organization will get these big windows, or if you pay more for a fancy hospital room, you'll get access to it. But they're really not luxuries. I mean, the evidence makes clear that they are critical to our functioning. So I think that's part of the gap. Why there's not more awareness of this research, I'm not entirely sure, except that sometimes these disciplines can be really siloed. And so, the work that scientists are doing sometimes doesn't travel very far beyond like the walls of that journal, which I think is a problem. In terms of other like mistakes in practice, I mean, a big one I would say is non-operable windows. So like even we see all these buildings that have windows, especially if you think about office buildings, but the occupants can't actually open them. And, a window is better than no window, but, fresh air is also really important. And to be able to feel the breeze and regulate your temperature and also air out indoor air pollutants. I mean, if there was one thing I could, wave a magic wand and have a wish granted, it would be like no more non-operable windows. You should be able to open all your windows.
That makes so much sense. And then there's a sense of agency or control that you have when you're able to open your space, right? Like your windows and be able to, I'm too hot, I'm too cold. So I agree. The other thing, I really like that concept of, maybe it's an outdated concept that access to windows or that corner office is a luxury, right? I like that concept because I think it's a status quo that I hadn't considered before, that it has been sort of associated as a luxury. So thanks for that kind of new nugget of info and way to look at it as, no, we all should have equal access, right? And so there's sort of a perhaps something that we could do to provide education so that we can shift the status quo. So, I work in healthcare space, and I thought it was so interesting that you reached back to Florence Nightingale's work in the 19th century, where she talks about the importance of windows, and the outcomes. And yet so many healthcare buildings don't maximize the power to improve patient outcomes. Do you see a correlation there between access to natural light and access to views and patient outcomes? We talked a little bit about it, but has your research yielded that there's a positive correlation there?
Yeah, absolutely. That's really clear. And a lot of this research on daylight and views was initially done in hospitals, and it's since expanded out to, offices and homes and other places. But, in addition to using fewer painkillers, which I mentioned before, patients in sort of sunny rooms or rooms with view are discharged sooner, and they even have lower mortality rates. And, I think, again, to go back to sort of the luxury question, like, in hospitals too, I think some of these things are seen as luxuries. And even if, we're not making much headway at convincing, hospital administration that like, no, the humane thing to do is provide daylight and views. I mean, there's a really compelling economic argument too. If patients are using fewer medications and they're being discharged sooner, that could save a hospital a lot of money. So I think, bringing those two arguments together might be one way to, spur change.
I think that's really important as well. And I think, unfortunately, the bottom line typically drives behavior. So, just in terms of like making sure everybody's on board with kind of why this is important, so we can shift it from like a nice to have category into a need to have category. And I didn't realize that the studies had started in healthcare and kind of drifted out into commercial spaces. That's really interesting to me. So just kind of to ask a question off of that, have you seen any commercial studies that essentially lean into that healthcare, but make the argument for commercial spaces and occupants? So essentially employees versus healthcare, right? So Is that something that you see, like a ripple effect that came from healthcare? And do you think those arguments are in alignment in terms of why, why it's important? Sorry.
No, absolutely. And some of the reasons you want daylight and views in like an office building are the same as in healthcare, particularly if you think about like reducing stress and anxiety. That's sort of good regardless of your environment. But commercial spaces and sort of studies of workplaces and schools have added this other layer, which is all sorts of research onto, it's what's sometimes called attention restoration theory. So this is looking more closely at how daylight and views can affect our cognition, which is, not something that maybe you're super concerned about in a hospital. But it turns out that like looking out a window, particularly at a natural landscape, it engages us in a sort of effortless way and allows our minds to rest, and then subsequently improves our focus and our attention spans and our productivity. And so there's been a lot of research in commercial spaces about those sorts of effects and, why they'd be good for office workers. So it's closely related to sort of the stress reduction theory, but it's a slightly different angle.
Yeah, so the angle is, it sounds like it's more cognitive versus, and so the restorative ... is connected to cognitive, but with regard to patients, it's healing and reduction of medication. And so there's a bottom line there, ... So that's very interesting. Thank you for that. I'm going to have to look. So you said attention restorative theory?
Yeah, so they're the two different theories, if you want the technical terms. So the one about that sort of originated in hospitals and that is very much about stress reduction is sometimes called the Biophilia Hypothesis. And that's very much about how looking at nature relaxes us, and that sort of stress reduction then has all sorts of downstream effects, reducing cortisol and dropping blood pressure. And that's how that seems to be working. And then sort of the companion theory is known as attention restoration theory. And that's more about how looking at nature allows the mind to rest, and then has some of the same downstream effects, but it's through sort of like a slightly different, more cognitive mechanism, if that makes sense.
Got it. No, it totally does. And thank you for that. So you visited a ton of research facilities, using both a qualitative and a quantitative, analysis to understand, I think, how to create better indoor spaces. What did you come away with, or, what do you think people in commercial real estate and building industries can learn from that research as it's, readily accessible?
Yeah, so I think one of the big lessons is that these environments and these effects are really complex, and there's no such thing as a one-size-fits-all space. If you're an office designer, different companies and different workers are performing different tasks. The individual workers have different needs and sensitivities and preferences. And so there's no such thing as, what does the best office look like? Because it means, then you have to ask for what and for who. And certain kinds of light seem to be better for multitasking, but other kinds of light seem to be better for creativity. So I think, that's a challenge, how do you design when that's true? But I think the takeaway from that is to design environments with flexibility and that have sort of some capacity for choice and control. So we're seeing, I think, more and more workspaces that have different micro environments. So, maybe there's an area with dim lighting and couches and it's really good for brainstorming. And then there's another part of the office that has, lots of cubicles and bright sort of task-oriented lighting. And so creating those different options, but then, that has to be accompanied by managers and companies that sort of trust their employees to know what they need and allow them to move throughout the space, as their tasks and needs change. So there's no real simple solution to that, but I think we need to be really conscious of the fact that different environments are good for different things.
I love your answer, and it made me think about our own headquarters in Malvern. And I know that the way that the way it's designed is kind of similar to what you're describing. Right? There's spaces that are more comfortable and spaces that are more structured. As an employee, I've never engaged on a level to think oh, I'm in the relaxed space, right? But I wonder if I knew that, right? If I knew that the lighting would enhance my creativity, do you think that could lead to better outcomes, or do you think that, so I guess my question is, should we educate the occupants about maybe the choices in design that went into that particular space? And would that help with the outcomes? Does that make sense?
Yeah, I mean, I think that's an interesting idea. And I think, it absolutely wouldn't hurt to tell people what the research shows. Like studies show that this kind of warm light might be best for creativity. Like maybe that's something to keep in mind or try. I mean, I also think that even those studies are based on averages, right? So like there's still maybe people for whom that is not true. And so you still need to trust people to know their own work styles and needs. But I think it would be interesting to like inform everyone of what the research says, so they could at least like try that out and see how that works for them.
Yeah, I think I might, if I, was struggling with, trying to solve something, right? I think I might choose the environment that was going to help me forge creativity if I had the choice, right? If I knew that that was the design of the space. So that's, I don't know, that it made me think of that. So how do you see technology changing how occupants experience space in the future, right? So I know that you wrote it and there's been some evolution given the pandemic. So what do you think is going to be, as we kind of take both of those factors into account, have you thought about what that's going to equal, maybe in 20 years from now?
Yeah, well, I think this follows like nicely from the previous question, because I think what technology can really do is help enable some of that choice and control. So one problem right now, beyond the fact that, workers might not be aware of the research, is that workers also, and we in general, don't have access to a lot of data about our indoor environments. Like you can pull out your phone and get a detailed weather report of what's going on outside and the pollen count and the humidity and all that stuff. But the insides of our buildings are kind of a black box. And so technology is, and I talk about some applications of like apps and sensors that, might tell employees in a big workspace, like, oh, this corner of the office is quieter and cooler than anywhere else in the office. And so like actually putting that information in the hands of employees to enable them to make choices. And then, it's also enabling more fine-tuned control when you think about things like smart thermostats or programmable lights. You could, if you, want every afternoon to have a setting over your desk that's better for creativity, but in the morning, you could set up those kinds of systems with technology. So I think tech is really going to make it possible to do some of those finer tuned things that just haven't been possible before.
I like that I think you're calling into the individual customization and our awareness of our preferences and how that leads to positive outcomes. So it sounds like a pretty great marriage if we're essentially as occupants communicating with our employers or even in our own spaces to create the environments that, we know the data supports, right, from your just kind of coaching on it, right? It's the average. So to at least have that in mind as we're shaping it and customizing it for our own preferences, right? So using it as a tool to guide us. That's really interesting concept. You asked a really interesting question in the book, what does it mean to design for human dignity? And that really stood out to me. And I feel like we're at a really important place in history. We're asking all of these questions of ourselves and of each other, right? And 2020 has been a year, right? An epic year for all of us. And, we've had, serious, with the murder of George Floyd and COVID-19 and climate change has been something of something that we're kind of, I don't know that that's really landed in the everyday speak, but it's something that it's pretty, it's critical, right? So how should we be thinking about design, given all those kind of elements and their overlap and intersection? How do you think we should be thinking about designing for human dignity as we move forward, right? So how can we do it with a socially responsible layer?
Yeah, that's something I've been thinking. a lot about, it's sort of one of the takeaways of the book, but then like the pandemic and, the Black Lives Matter protests have really prompted me to think even more about it this spring. I mean, I think the key is that, or one key is that design really can communicate our values, what we value and who we value. And it does that both to the wider world and to the occupants themselves. So, we could design an office that is optimized purely for productivity and like churning out as many widgets as possible per hour. And that might, involve like a lot of desks crammed close together. Or we could create an office that balances that or that is optimized for employee well-being. And in terms of the pandemic, I've been thinking about, a lot of the super spreader events and where they're happening. And especially early on, it was in places like jails and prisons, in meatpacking plants, in homeless shelters, in migrant dorms, basically in buildings that were occupied by low income and or marginalized people. And I don't think that's an accident. I think that tells us something about who gets access to safe environments and who doesn't. And so I think, go ahead.
I think that's brilliant. I think that's brilliant. You're talking about systemic, potentially the impact of how systems have been created in order to essentially create a non-egalitarian world where it comes to having access to healthy spaces. Mm-hmm. I hadn't even put those two together. So I'm nodding with you just to say thank you for putting those things together, because that really, I got to sit with that concept. And I didn't mean to interrupt you. Please.
Oh, no, that's okay. No, and I was just going to say, so like in terms of moving forward, like that definitely involves rethinking how we design these spaces, but it's not just a design question. Like really to solve these problems requires policy change and cultural change. So, like whether from like rethinking zoning to decarceration, so design is a part of that, but there are all these other aspects of our society that have sort of enabled or prompted these unsafe spaces to be built. So like, it's a much bigger problem than just like get an architect to draft a new kind of building.
Yeah, no, I think you're absolutely right. It's going to take, policy drives everything, right? And I think you're right. It's policy, it's local jurisdiction, and then it's how, federal jurisdiction. So you're completely right to contextualize. I wonder if, kind of given where we're at and the way that I see that your mind works, are you thinking in terms of like the next book and, like kind of figuring out like the next layer of where society, where society is, where COVID has put us? Have you thought about how that's going to influence your next book, and are you thinking about it in that way?
Not in terms of the next book. Like I'm going to go back to freelancing for a while, and sort of, I don't know what the next book will be about yet. But certainly it's something I'm writing and thinking about in like shorter freelance pieces right now. Because the book was basically finalized before the pandemic hit, lots of it is resonant, but I don't address it directly. So right now I'm working on pieces that sort of do tie what I've learned into the current circumstances in the pandemic. So
fantastic.
I'm thinking about that in terms of sort of shorter pieces right now.
So I'm a fan. I, read this book. I think it's amazing, and I want to follow your work. So how do I do that? Like, what can you suggest to the readers to hear about, like the work that you're talking about now, like the shorter form pieces? Like, what can we do to follow you?
Yeah, so the best sort of like landing site for all that is my personal website, which is emilyanthes.com. I'm also on fairly active on Twitter at Emily Anthes, all one word. I have a newsletter, which might be the best way that you can subscribe to, that I send out every, roughly every 2 weeks, that includes both links to things I've written as well as like links to other stories, on topics that are related to this. It's emilyanthes.substack, but also if you go to my website, you will see all those links there.
Great, Emily. I think your work is great, and I'm going to be I'm going to subscribe, and I look forward to getting your updates and just kind of following you, because I just really enjoy your work, and I just want to thank you for, your work and for taking some time to talk to us today.
Of course. Thank you so much for your interest.